Good afternoon, everyone. Thanks for being here today. We're going to get started, and so I have the honor of introducing our conversationalists. My name is Jamie Potter Rutledge. I am the Assistant Dean for Diversity, Equity, and Inclusion here at the School of Public Health. And I have the honor of welcoming our conversationalists this afternoon. Welcome all to our very first Resilience in Public Health series event this semester. This is a continuation of our series from last semester, and we have created these events to be intended to create a space to reflect on the current socio-political moment, its impact on public health, and to learn about ways that we can remain collectively resilient. It's wonderful to see so many of you today gathered here to explore what it truly means to build resilience, not just in our systems, but in our civic life. Today, our focus is on civic health, the strength of our connections to one another and to the institutions that shape our communities. Civic health is at its core public health. When people are engaged, informed, and feel a sense of belonging and trust, our communities become more equitable, more resilient, and better prepared to meet the challenge ahead, which feels particularly urgent in today's polarized political climate. We're especially excited to highlight the Action Guide for Improving Civic Health in Rhode Island, a tool to help communities across our state put civic engagement into action through collaboration, data, and shared purpose. We're fortunate to be joined by distinguished leaders who each bring a unique perspective on this work. David Cicilline, the president and CEO of the Rhode Island Foundation, whose leadership continues to strengthen the fabric of our state. Dean Francesca Beaudoin, I probably messed that up, a leading voice in public health and community resilience. And Dean John Friedman, whose research and insights help us to understand how data and policy can drive opportunity and civic vitality. I want to thank my colleagues for all of their support on this event. I also want to thank the Rhode Island Foundation for their work in leadership and civic health, the Watson School of International Public Affairs for their partnership, and thank you all for being a part of this important conversation. Together, we'll explore how we can strengthen Rhode Island's civic health, and in doing so, build a more resilient and connected and healthy future for us all. I'll now introduce our conversationalists. First, we have our moderator, Sarah Bouchard. Sarah is a native Rhode Islander who received her BA in International Studies, her Master's of Social Work in Clinical Social Work with a concentration in health and mental health, and a Master's in Pastoral Ministry from Boston College. She also holds a graduate certificate in human rights and international justice and is a licensed certified social worker in the state of Massachusetts. Sarah is passionate about working with communities to forge partnerships that address social challenges and advance human rights. She has worked with a variety of nonprofits, international NGOs, and institutions to support underserved populations, promote individual and community health, foster community-engaged partnerships, and educate students. We'll also be joined by Francesca, who is the academic dean of Brown University School of Public Health and a professor of epidemiology, a board-certified emergency physician and clinical epidemiologist. She specializes in opioid use disorders and pain, focusing on the comparative effectiveness of opioids in their alternatives, interventions for opioid use disorder, and the neuropsychiatric effects of trauma. She continues to practice medicine with Kodak Behavioral Health Care's Mobile Addiction Treatment Unit and has developed opioid prescribing and pain management policies for healthcare systems. Francesca has served on the FDA's Anesthetic and Analgesic Drug Products Advisory Committee, led an NIH-funded project to develop a mobile peer recovery app, and collaborates with organizations such as the Rhode Island Department of Health, the Governor's Task Force on Opioid Overdoses, and the Institute for Clinical and Economic Review. We now have David Cicilline. David Cicilline, class of 1983, is currently the president and CEO of the Rhode Island Foundation. Prior to this role, he served Rhode Island's first congressional district in the U.S. House of Representatives. Cicilline was a member of the House Democratic leadership, serving as chair of the Democratic Policy and Communications Committee. He was also a leader in Congress on issues of core American values, having served as chairman of the House Antitrust Subcommittee, co-chair of the Congressional LGBT Equity Caucus, and vice chair of the Congressional Progressive Caucus. Prior to his election to Congress, Cicilline served 2 terms as mayor of Providence and 4 terms in the Rhode Island House of Representatives. And finally, we have John Friedman, who is the inaugural Vassarello Family Dean of Brown University's Thomas J. Watson Jr. School of International and Public Affairs and the Bridger Family Distinguished Professor of Economics and International and Public Affairs. A founding co-director of Opportunity Insights, his research uses big data to study inequality, education, poverty, and tax policy. His work on teacher impact, social mobility, and higher education admissions has shaped national policy discussions and was cited by President Obama in the 2012 State of the Union address. Friedman helped create the Economic Tracker during COVID-19 crisis, co-edits the American Economic Review, and serves as president-elect of the Eastern Economic Association. He previously served in the Obama White House, chaired Brown's economics department, and holds a AB, AM, and PhD degrees in economics from Harvard University. Please join me in welcoming them all.
Thank you for that introduction, Jamie, and welcome everyone. It's a delight to speak today, and we'll start, David, with you. The Rhode Island Foundation worked really diligently to create this comprehensive civic action plan, and we're curious to maybe help the audience start in the same foundational place. Can you give us a description of what is civic health and why is it important to the state?
Sure. Thank you for including me. So when the Rhode Island Foundation developed our 5-year action plan, we spent about 18 months really listening to Rhode Islanders traveling across the state, and we heard over and over again questions about could the Rhode Island Foundation play more of a role in helping to bridge some of the divisions, to reconnect people to their neighbors, to reduce some of the polarization, and to really invest in strategies that will improve the civic health of the communities in which people live. And in many ways, the Community Foundation is uniquely positioned to do that. And when we talk about civic health, we really are speaking about it in very broad terms. People feeling connected to the places they live, to the institutions that are in their communities, to the people in those communities, that they're living in a way that they feel their voices being heard, that they have an opportunity to connect to other people in the community, and that there's civic infrastructure that really allows all of that to happen. There's a lot of research. I'm clearly not the academic on the panel, but there's a lot of research that shows that people who live in communities where there's good civic health, where they feel connected and engaged in the civic life of that community, that there are all kinds of positive outcomes that come from that. So we included the priority of civic health as part of our 5-year action plan.
Fantastic. And could you share just a little bit about the process of creating the plan itself? It is so, and if folks haven't had a chance to check it out, we would recommend it. There's a lot of real strategies in there. What was the process like?
Yes. So when we decided that we would include civic health in our one of our community priorities in the 5-year action plan, we actually coupled civic health with cultural life, because part of what we also do is fund arts and cultural organizations for the value that they bring to a community, obviously in and of themselves, but also because very often cultural opportunities are places where people come together of very different backgrounds, very different political views, very different upbringings, but share an experience of listening to music or going to a performance of some kind, and in that moment really identify their shared humanity. So we put those two things together. And when we decided to make this a priority, we engaged with the National Civic League, which is America's oldest civics association. And we spent a full year engaging with Rhode Islanders about strategies that would be effective in improving the civic health of Rhode Island. And we ended up with this toolbox, which is really a kit, a beginning point for Rhode Islanders who are interested in improving the civic health of our state, to look at different ways to do that and different ways to participate.
Thank you. And Francesca, we've chatted about this a bit, but can you share a little bit about the threats that you see impacting civic health and how those might parallel threats to public health currently?
Yeah, thanks, Sarah. So Jamie started off, I think, nicely talking about the overlap between civic health and public health, and that a functioning civic society and having good civic health is really a requisite for public health, right? And having healthy populations. And some of you may be sitting here saying, I didn't even know that civic health was a thing. And I fell into that camp as well. The last time I had exposure to civics probably was in, other than our everyday life and being good citizens, but like formally was in high school. And this term civic health, I will answer the question, I promise. But I'm going to tap David for a second, because we were talking before this about like, where did this term civic health actually come from? And why am I hearing about it more now than in the past? And I thought maybe you could give the background, because it was both like a little bit of a wake. It was kind of almost like disturbing, like why we're talking about civic health in the way that we are now. But I think it's an important part of the conversation.
Absolutely. So when this work began, we were speaking about kind of strategies to strengthen our democratic institutions, because some of this is about making sure we're living in a functioning democracy. And when we began this work in Rhode Island, it was the beginning of building a coalition of community foundations around the country committed to improving the civic health of their communities. And so I knew, although we had engaged with the National Civic League, and my first priority was Rhode Island, because I lead the Rhode Island Foundation, we wanted to have some opportunity to share what we were doing and learning with community foundations around the country and build a coalition of community foundations committed to this work. And what we learned early in the process was that if we use the word democracy, there had been some polling done by the Democracy Fund, in half of America that is viewed as a partisan term. Let that sink in. So in half of the country, the word democracy is a partisan term. So we decided as a collective that if we were going to do this everywhere in the country and lead this national effort, we had to use language which welcomed people into the conversation. And we came to the realization that civic health was a good term. There's a civic health index. People are familiar that health is something they think about, and it's something you can impact and measure. And so we use the term civic health as a kind of function of the moment we're in. So, and it is.
Yeah,
kind of
it's, and
sad.
I think, but it really important to bring to the table, like we are talking about threats to both civic health and then by virtue of that, public health, misinformation, distrust in institutions, distrust in experts, increasingly fragmented society, people feeling like a lack of community, inclusion, all of these things. And so it's like, what do we do about that? And the answer to improving civic health by virtue of that improves public health as well. And we are having these conversations a lot in the School of Public Health. It's why we have a Department of Behavioral and Social Sciences, some of our faculty sitting over there, because this is a conversation we need to be having right now, and in this moment. So the threats to both are the same, and I think that's what we have to be talking about.
Thank you. And John, we know civics is very much in your wheelhouse. Can you share a bit about the broader policy implications for civic health that you see?
Yeah, sure. So first of all, I just want to thank Francesca and the School of Public Health for partnering us on this conversation today. It's so exciting to be part of it, and thank you all for coming. So when we think about a functioning democracy, as David said, right, so much of that rests not only in a set of formal procedures that allow people to vote or describe how a bill gets passed. It rests in this participation of citizens in not just that formal process, but in the broader suite of civic institutions that contribute to it. And then in turn, that participation, right, that doesn't just happen by itself either. That rests on a far broader set of dimensions around how people are connected to other people in society, right? And you can think about that, for instance, in about the network density, right? It turns out to be a really great thing when neighbors not just know each other, but think about there's kind of a really tangled, interwoven network within a community, like your friends or themselves friends with each other. What also matters is the breadth of those networks. And this turns out to be especially important, the extent to which people not just are aware of, but really are deeply connected to people who are in quite different situations in society, and whether that be across racial boundaries, across socioeconomic boundaries, across physical spaces, so people kind of know what's going on, more broadly beyond their neighborhood. This is what's wrapped up in a lot of literature is in a term called social capital that some of you may have heard, and this turns out to be just incredibly important for not just health, not just the functioning of democracies, but an incredibly wide range of things like upward mobility. It turns out to be very important for the way that our schools function. And so, thinking about, as David and the Rhode Island Foundation have done, thinking about that really practical perspective, how do we support this? How do we make sure that this critical, element of what makes our society successful is being tended to, right? We have institutions that are schools and universities that think about education around teaching people how to read and how to analyze things, but sometimes we don't have institutions that are as focused on that social capital dimension of what's going on. And so having this effort from the Rhode Island Foundation is, I think, really important, not just for the functioning of democracies, for public health, but for more broadly, so many of what we look for in the success of our society.
Thanks, John. Do you think, it's such an interesting piece to think about how this impacts civic health. Can you speak a little bit about those other areas too? I'm curious to see how this impacts other important policy spaces.
Yeah, so for instance, if you are thinking about the question, what leads to upward mobility? What leads to the opportunity that children have that no matter the circumstances of their birth, they have the chance to grow up and achieve great things in their life, whether that's a stable income, whether that's the type of career that they want, however one defines that. Turns out that social capital in this broad sense, that is the best thing that we have in order to predict what societies or what neighborhoods or what types of people are going to have that opportunity. That's also true if you look at how these things have been changing over time. If you look at ways in which, unfortunately, we see that the opportunity for kids to, say, achieve a higher standard of living than their parents did a generation before, that's been declining in the United States over the past 2 generations, and that decline correlates quite closely, not just overall, but in the particular places where it's been more severe, with changes in social capital. And those are just kind of some examples of the ways in which this is quite broad. It's also true if you look at correlations with mortality rates or with life expectancy for adults. Social capital, there too, is a very, very strong predictor of what types of people or what types of places will feature higher or lower life expectancies in the U.S.
Can I chime in?
Yes, please.
As you're talking, what I'm thinking about a lot is the digital world that we live in. And the phrase that popped into my head, this is not what it's meant to mean, is digital divide. When we talk about digital divides, we're talking about some people have access to high-speed internet, others don't, smartphones. And I think that type of divide is closing, but we're creating this new type of divide and fragmentation in the digital world that we live in. I'm wondering how much both of you think that is a driver of some of the problems that we're seeing, and then what are the solutions? And I think even reflecting on my day-to-day interactions, if I'm going to order a coffee, I'm almost exclusively going to do it from my phone, and I'm going to pick it up. Maybe I'll get a Starbucks on Thayer Street when I leave here. I'm going to order it from my phone, and I might not talk to
Not anymore, you're not.
Oh, what happened?
Well, you're going to have to ask the CEO of Starbucks about that, but...
Oh, no. Well, I'm going to go to Dave's on, no. But I might order something from my phone, right, and not interact with another human. So how much is this a driver, and how do we also maybe leverage that environment as part of the action plan?
Yeah, I think it's actually a big part of the driver. And there was a report today, I think the number is 40% of meals from restaurants are consumed outside of the restaurant. So it used to be that you'd go to the restaurant with your friend, or maybe go to the restaurant with your family, and now that food is being ordered and delivered to your house, very often consumed alone. So that's just today, just one example. So I do think there is no doubt that technology has allowed the acceleration of isolation in a lot of ways. I mean, it seems ironic because it's also led to the connection in tremendous ways. But I think there is no doubt that it has led to an ability to engage in regular activities alone more easily, which I think has implications. But I think there's actually a far more pernicious consequence of the rise of technology and social media platforms, and that is the spread of misinformation at scale. I mean, it used to be, there's a pretty good system if you make up a story about a neighbor that's untrue and you said it and you wrote a letter to the editor saying, my neighbor murdered 3 people, like the paper wouldn't print it, you would get sued. There's a whole structure that prevents you from promoting something which is untruthful. Online, there's actually not only nothing to prevent that, it's facilitated at scale. You can hit a button and you publish it to millions of people in a nanosecond with absolutely no consequence. And it turns out that these social media platforms are designed in a way to, they make their money based on engagement. And the things that have the deepest engagement are the most untruthful, the most violent, the most outrageous claims. You put a post of you and your cat, like nobody views it. And so they have a business model which incentivizes the amplification of the worst content. And there is no current system that holds them accountable because Congress gave them an exception from liability under Section 230. So there is no system. And so they're not going to fix it themselves because that's a business model that makes enormous money for them. And so I do think this is a big fundamental problem. I do think there are solutions, which Congress has so far not enacted, to regulate, what gets put on a platform and create some liability. I'll just say one last thing. There's actually an interesting case where a guy was killed by Hamas, and his family sued Facebook because they met like in a terrorist chat room. And of course, the court dismissed the case, saying Section 230 provides immunity from liability. There was a dissenting opinion in that case where the judge said, wait a minute. The original post that was posted on Facebook, that's immune from liability under Section 230. But then Facebook made a set of business decisions of what algorithms to apply to maximize the profit from that posting. And for those decisions, they're not immune from liability. So they sort of broke it up. So I do think there's an answer to this. But so far, we haven't had much of that legislation enacted. But I think it's a big source of the deterioration of social capital and the deepening polarization in this country. And I think, if we don't fix that, it's going to be really hard to fix the civic health of our country, I think.
Yeah, so I agree with David that social media has not been helpful in terms of the spread of misinformation. But I think that there are kind of a couple of steps between the rise in loneliness, which has been very clearly captured in data, and misinformation. And I think that first of all, it's about not just whether you're connected with anyone else, right? That's what loneliness is. It's, are you connected with a group of people that in some ways is broad, right? And when I say connected to, right, think about like really meaningful engagements. It does not have to be somebody where you're bearing your life story, but you want something more than like 2 people who are, sitting at a different table in a restaurant, or maybe to think about a more like civic institution. There's some great data about how students who are attending the same school actually may not develop any social capital and connections between them, if the way that the school is set up is, say highly segregated, where for instance, if you have, one set of students taking classes on one floor and another set of students taking classes on a different floor, I don't know if you all have been to a high school lunchroom, but like those people are not going to be, hanging out and like really mixing together often of their own accord in the lunchroom. Like they're going to be quite segregated, even if they're physically proximate to one another, right? And so I think the first piece that we really want to think about is, how do we get that kind of somewhat meaningful engagement between people? And actually something that David said, and he has in the plan, which turns out to be a much broader strategy that works, is to take advantage of whether it be interests or institutions that are apart from many of the ways that stratify. So, arts institutions are a great example. Two other ones that really pop out in the data as institutions that really pull people together across really diverse sets of backgrounds are athletic clubs or institutions, and actually religious institutions, and you kind of see how that works, where it gives people a reason to be there. It gives them a shared set of something around which to connect. And then what flows from that is like, oh, well, we're not just now like playing on the soccer team together, but like I learned that like you come from a very different background than I do, and we learned something about that. And it's that type of engagement that I think starts to lead to a lot of these beneficial effects that we're talking about of civic health. I also think there's a dimension which is really explicitly political and partisan, right? We've seen growing polarization in society. Probably part of that is due to social media, where it's easier to be connected to other people that think like you. But also we're seeing this in the way that individuals are arranged geographically. Like, it is actually the fact that it is just harder to randomly walk around where you live or where you work and meet people that think about things differently than you. And I will add that like this institution is no exception to that, right? This is like a highly partisan, not that there's a partisan objective to what's going on here, but the types of people that we have here are not politically representative of those more broadly in the United States. And we can talk about why that is. Nobody's going about it purposely to do that, but still that makes it very difficult to have those types of broad-based connections on a political dimension. And I think those things are a lot of what lead to the type of mistrust in institutions and mistrust in experts, right? It's not just that it's easier to spread misinformation when you're in those type of ill-connected social situations. It's also just much more difficult for you to figure out what's misinformation because you don't have that reinforcement coming from many different perspectives.
I wonder if we could pick up on that for a moment, the sense of trust. And I know in the plan, it was really well stated. The key is tapping into that web of existing trusting relationships in the community. And that does seem to speak to this idea of thin versus thick engagement. Thin being maybe online activism versus thick being really showing up in your community and participating in an in-person kind of way. But can you both, or all of you, please speak to trust, and what is the role you see in trust in public health and civic discourse and in tackling some of these challenges?
I mean, this is like the core of the issue that we're watching play out right now, is this intense distrust in institutions and experts and a rejection of data. And I think for individuals, the power of the anecdote is very, very powerful. And so people are much more likely to trust a narrative or a story, even if it's something that's fed to them on, a 30-second reel online, that feels palpable and true in a way that data doesn't. And this is our challenge as public health experts. We have to find a better way to engage and to communicate findings. Like, I think we have to own the trust problem. We're not the sole source of the trust problem, but we have to find a way to create more trust in what we do, because there's a reason why, like, we're watching with all the Tylenol stuff, right, that played out recently, that now we see people trusting, false information, experts that are not experts, and undermining what is like the actual truth in the universe. And how do we navigate that and move forward in a way that's productive and nonpartisan? We keep going back to talking about politics because politics has created all these deep divides that we know to be true. But I bet even within this room, there's a wide range of political views, but I bet we can come to some like large agreement about our health and what we want for our kids or future kids and these things. And so orienting to those aspects. I like very much this thick versus thin engagement. And for those of you that know me, and I mentioned that to these guys as we were prepping to come in here, I really love organizational psychology and thinking about kind of what makes organizations function and what leads to high performing organizations. And that's all about kind of the culture that we set in the community. And I said to David, I was like, our country needs an organizational psychologist. When I meet people on the street, and I feel like I have interactions with a wide swath of individuals from different backgrounds, stemming like my clinical work on a mobile unit in Woonsocket on Friday mornings, to interacting with parents on my kids' sports teams in Cumberland, to being at the School of Public Health, to extending beyond the borders of Rhode Island. And when you talk to people, everybody thinks that we're living in this bad society right now, regardless of what the political lean is. And I have family members who have very different political leanings than my own. But there is, I think, an appetite to have a better culture, right? And that directly feeds into like having trust. If you don't have a good culture and community, you don't trust the environment that you're in. And so it is this enormous problem that we're facing right now. And I think the solutions are grassroots in nature. And that's why I love that we have this action plan stemming from our little state, where I think we can do this here. We can have control what you can control. I think a lot of this is advice that I like give to my own kids, like control what you can control. And I think that's what we have to do here at Brown in Rhode Island.
Yeah, I would just say, I think to build on also what John just said, I do think part of this is about exposing and creating opportunities for people to engage with people who have different views and are from different parts of the country and have different attitudes. And it's hard to do. I mean, if you look back, it used to happen kind of during wartime, because you'd be, for the men particularly, you'd be sent to a platoon and there would be people from 4 other parts of the country, and you would be joined together in this very important moment and kind of learn. And I'm not suggesting we need another world war, but like those opportunities don't exist as much today. And so part of what is in the Civic Health Plan is how do we support national service? So if everyone has an opportunity to work a year of service where you develop a sense of your responsibility to your collective community, but you do it in a place and with people that are different from you, a different part of the country, to learn about that. There's a new group called the American Exchange Project, created by, not John Meacham's son, David McCulloch's grandson. It's basically an exchange program where you spend a week, a high school student from Rhode Island spends a week in, Des Moines, Iowa, and vice versa. And they learn just in a week. It was enough time to develop an understanding of a place and a relationship with people from a very different place, just to learn, almost like we used to do for our exchange program in Europe, but now like learn about America. And so creating those opportunities, I think, is ways to start to trust, other people. And because I do think trust is both at the center of public health and civic health, I think the other piece of it, which is essential, is helping people identify trustworthy, reliable sources of information. And that's why part of the civic health work is how do you support local journalism, which people tend to trust more than national journalism. So how do you create ecosystems and sources for people to get accurate, trustworthy information to make informed decisions, whether it be about candidates or public health issues, but supporting, you look at the deterioration of local journalism as a result of the rise of technology. And it's contributed to this. So there's a big effort underway. The MacArthur Foundation committed $500 million to support local journalism. Press Forward is the way they're doing it. The Rhode Island Foundation, along with the Van Buren Charitable Trust, is creating a Press Forward chapter here in Rhode Island. But I do think that's a really important issue in terms of trust, is how do you create an understanding of what are trustworthy, reliable sources of information. So when people say, this is what I believe, and you're like, how do you believe it? I saw it online. Okay, well, maybe you say, like, is that a trustworthy, reliable source of information? Where did that come from? Where did that information come from? And training people in conversations to say, why do you think that? Where did you learn that? As a way to engage in a conversation, rather than saying, you're crazy, you're stupid, you can't possibly think that. Teaching people how to engage with each other in that way.
I think as folks are listening to this, I find myself thinking, like, how can I better engage, and how can we all better engage? And I think of the resources at our disposal at a place like Brown, and we have such exceptional research happening. And I'm curious if you all have thoughts around how can research be used to support policy in civic health and civic engagement, and how can we use those resources to improve this effort nationally?
So I think that people, part of this is about exposing people to different perspectives and new sources, but part of it is also just about shaping the way that people, think about these issues more broadly. And, the the reality is that, and I hate to say this for us, those on the panel here, like people are just much more flexible in shaping the way they think about things when they're growing up and when they're kids, and that's just one way. It's not just about the literal plasticity of the brain, but so much of what animates a person that goes beyond like what they know or who they know, but even the way that they go about things, the things that they value in the world, right? Think about, this is like a simple example from kind of a thing called cultural evolution literature, but think about why it is that you do or don't like spicy food, right? You didn't have like a spicy food mentor. Nobody taught you to like spicy food. And yet, if you think about it, it's intimately bound up with where you grew up and who was around you and what your parents were doing and what did your older sibling or some like other friends of yours on the playground, what did they eat? And you're like, oh, hey, like I kind of want to be like them. Like that's what I'm going to eat. And like, just think about how that, right? It's no longer something that you choose to do. It's just like a preference that you have. So there's like a bunch of people who choose to eat stuff that tricks your body into thinking that it's too hot and start sweating because you're eating something. And there's like a whole bunch of people who be like, because of this cultural process are like, oh yeah, that's awesome. Like, let me do more of that, right? It's incredibly strange at one point, but it's like, think about how deep.
You don't like spicy food.
I do, I love it. I just own the fact that it is strange. I love it. But I just, think about how deeply baked in that is. And then think about, what do we need to do in order to get the interest in engaging broadly and kind of a value of these types of connections for their own sake, a value of civic engagement, a commitment to national service. Like all these things come from somewhere. And I think that, thinking about how we can help do this for kids is perhaps the most effective way. And whether that's through research or like literally going out and being a mentor and helping out in the community, I think these are both ways that we can all help on this front.
And David, I'm thinking also about the great example you shared about cross-cultural exchange and sort of these positive steps folks can take towards solutions. And I wonder if we could collectively think a little bit about solutions. In the plan, you talk about an asset-based approach and how important that is. And I think sometimes in public health and other spaces, it's easy for us to look at problems to focus on versus the strengths in the room or the assets. And so I wonder, as we think about solutions, can we talk a little bit about the importance of an asset-based approach and how that might look in this work?
Yeah, I mean, I think this is no different than other asset-based approaches, is looking at a community and thinking not just where are the problems and shortcomings, but what are the strengths, what are the opportunities that exist because of either existing relationships or institutions that are deeply trusted. I mean, actually, I think this is where community foundations can play an oversized role. There are 900 community foundations in the country. They're all in communities where their boards and their donors and their employees are respected members of the community and trusted. And so I think that's their superpower, that they're really trusted and they're local. A lot of this trust building really can't happen from people from the outside saying, you should do this. It really has to come up in partnership with the community. So I think building on whatever those strengths are in cultural, academic, financial institutions and being sure that you're building plans around that is really critical.
I think
That's
why you are in the role that you're in, Sarah. And community engagement is so key. And we spend a lot of time thinking about who has the power in the communities, both to make decisions, but also has the power to gather and motivate and enable and empower people to make good public health choices for themselves. I think there are some very nice examples actually from the pandemic where people worked with local religious organizations, churches, and to educate people about vaccines and to hold vaccination clinics. I liked that you talked about athletic clubs and where do people gather, where do people connect, and we need to be doing more of that. I think this is actually something that we do like reasonably well in public health, and maybe this can more broadly impact civic health as well. But as we like reorient to trying to build back trust, those organizations and the community engagement piece, I think, are really key. And a place where Brown, and I mean, that's a takeaway for all of you who showed up in this room today, is to think about like, how can you show up more effectively in the groups that you belong to, whether it be a peer group of students here, a community organization that you go to, a gym, an athletic club, a church, or other space where people gather. How can you improve civic health and public health in those spaces, and partnering with institutions like Brown or your schools, your departments, your research centers, and having us show up better in those spaces as well.
Fantastic. Thinking along the lines of civic health, I mean, we talk about civic health as the health of our infrastructure for social connection to impact change collectively. But I think we know that folks who participate in civic engagement, there's evidence that that improves your personal health as well as allows you to engage in collective efforts to benefit all of our health. And I wonder if we could talk about examples where we see that happening, whether in Rhode Island or elsewhere. There's some really exciting examples to highlight.
Yeah, I mean, I think one great example, and I want to be sure I get the facts right. So one example is an investment we've made over a number of years on something called the Health Equity Zones. And this is really an initiative that really, I think, shows the intersection really clearly between civic health and public health. And this is an effort by residents of a community really to build more resilient and healthier community by aligning the investments they're making around public health with other assets in the community. And so as an example, where we're doing an evaluation of the health equity zones across the state. And an example is there was a HES that supported a participatory budget process in 2023 that really helped the residents of that community, this happened to be Central Falls, decide how to spend $1 million. And so in doing so, they made decisions about investments in education and health opportunities, but also they made decisions about renovating a school cafeteria. And it was an exercise in which they made decisions about their own community, engaged in a very kind of explicit civic exercise to do that, but was also at the same time making decisions to improve the health, the actual physical health of that community. The Newport Health Equity Zone similarly did the same kind of thing. They developed a plan to activate a transportation advocacy plan, as well as increasing the visibility of equity as a site-wide priority, and then achieved a long-term set of outcomes regarding the placement of residents in each of the following. And they were like a planning board, an affirmative action commission, a bike and pedestrian advisory commission. So really using this HES as a way to not only make decisions that will improve their well-being, but also to deeply engage in their community and improve their own civic health, both as a neighborhood, but as individuals as well. Those are two examples. But I think HESs are places where there's this very explicit overlap between public health and civic health, and really a demonstration that you can improve both simultaneously.
John, I wonder, thinking about, even beyond public health, do you see examples maybe at the national scale where things are working well, or you see efforts gaining traction?
Yeah, I mean, I think, so much of what's important here is physical proximity, right? It's just very difficult, even with all that we have in the online world, it's just very difficult for people to engage deeply with people who are not physically proximate. And so I think that David's talking about some great work, really thinking about how do we get people more engaged in a community, right? The other level of it is thinking about, how these communities are structured in the first place. And, some of the, not suggesting it's something that the Rhode Island Foundation is going to be able to fund directly, but, some of the work that nationally has made enormous impacts on this are investments really to revitalize neighborhoods. And the particular way in which that seems to have not just benefited civic health, but really led to huge changes in the kind of opportunities and the health of residents is by changing the structure with which people interact in the neighborhood. So just to give an example, there's a program called Hope 6, which was federally funded. You probably voted for this at some point, David. Hope 6 spent about $15 billion revitalizing like 200 neighborhoods across the U.S. This was a program passed at the beginning of the Clinton administration and kind of in various forms continued for about the next 20 years. And one of the things that they ended up doing were to take kind of 1960s, 1970s era public housing structures that had often, they were both kind of just very like low quality, that had deteriorated quite a bit. But from the kind of social capital engagement perspective, they were these islands of almost often extreme poverty, which was not only very kind of not great for the residents, but it also meant that there was essentially zero interaction between those who lived in these buildings and even those who lived right in an area around it. And so what this program did is it knocked a bunch of these towers down and it rebuilt what were mixed income public housing structures. And it's not just that the experience in those new structures was better than the old, they were much better integrated into the neighborhood around it. And you can even see it, some of these data sets that use people's phones to figure out like how much time they're spending literally in different houses. You can literally track that like kids that are living kind of in the new public housing project as opposed to the old public housing project are spending more time in the houses of other children who are living in like the neighboring half mile or something like that. And so I think that really it's a combination of these kind of more like macro approaches of changing the structure at which neighborhoods exist to begin with, and then approaches like this, which are kind of taking the structure of an existing neighborhood as given, and then trying to work within that to increase the amount of civic health. I think both of these are really important as we think about kind of moving to where we want to be as a state and as a country.
Fantastic, thank you. David, before we came out, you were chatting a bit with us about social mobility and people's ability to engage based on if they think it will be effective. And I wonder if we could talk as a group a little bit about that. I think we know when people do engage, we see health improve for those individuals, but often we face a barrier individually to engage because we may think, oh, like, what's this really going to do? And so I wonder if you could speak a little bit about that. I know you have a lot of thoughts on that.
Yes. Well, I mean, I think one of the challenges that we face in all of this work is when you speak about the declining confidence in institutions, and one of the principal institutions there's a significant decline in is the trust in government. And a lot of people spend a lot of time, I was mentioning earlier, focusing on, well, it's because this political party or that political party is not messaging the right way. And actually, I think it's the issue is much more fundamental, and that is that people have a sense that the institutions of government at the local, state, and particularly at the federal level are not responding to the needs that they've identified. And that, so, it's hard to kind of continue to trust in an institution if you feel like I've shared with this institution, my government, what my needs are, and those needs haven't been responded to. And so I think lots of people spend time focusing on communication strategy and the way we're talking about things. And I, one, believe that actually if we delivered to people on the issues that matter in their lives, that would do the most to restore trust in government than anything else we could do. And I was using the example of, when I served in Congress, we passed, 50 or 75 pieces of legislation that were wildly popular. Everything from raising the minimum wage to universal background checks to the Equality Act, things which a very strong majority of the American people supported. And none of them became law. They'd been passed by the House. The Democrats controlled the House, the Senate, and the White House. And so if you're a voter who supported those ideas and you think, I worked hard, we elected all these, none of that stuff became a reality. The reason it didn't become a reality is because we have a political system that allowed a minority in the Senate to overrule the will of the majority in every instance. And so it preserved the filibuster. And so if you said to people, well, I know we didn't deliver on any of the things that matter in your family's life, but I have good news for you. We preserved the Senate filibuster, this important tradition. Like, what are you talking about? And so I do think like some of this is just fundamental. Like if there was a biography written about Mitch McConnell by Dana Milbank, and I think one of the things he spoke about when he talked about that book was that the Republican Party knew that if you eliminated the filibuster and all of that legislation became a reality, the Democratic Party would become the permanent majority in this country. And I think there's like some truth to this. Like it's hard to explain to people that those priorities didn't become true. So I do think, like, in the end, if we're serious about restoring the faith in institutions, whether it be government or other institutions, those institutions have to deliver for the people they serve. I think there's a lot of evidence that the system, of our national government, the way it's designed, if you think about the Senate, it's already sort of undemocratic because many small states that have very small populations, there's a real
You have to be
conservative.
careful right here, David.
There's a conservative, no, including us, I get it, but the truth is, the United States Senate
Former
is
congressman
skewed very
supports
heavily.
reform to reduce Rhode
No,
Island's
it's skewed
representation
very
in the
heavily
federal
to the
government.
conservative
Headline.
part of the country, and that's just a fact. Then you layer onto it this filibuster that gives the minority party the ability to overrule the will of the majority. It creates a lot of cynicism whether democracy actually works and responsive. So I do think, like, some of the cynicism we can work around the edges, but some of it is fundamentally making sure the government is designed in a way to actually deliver results to the people on the issues that are important in their lives.
So I think it's clearly the case that the U.S. Senate has increased representation for places that are not densely populated states, right? So this is basically kind of a political increase in representation for rural areas. Now, you describe this as an increase in representation for conservative areas, and of course, in today's politics, that's right. But that's actually a relatively recent phenomenon, right? If you go back 25 years, there was not actually a very large gap between the way that people in rural areas and people in more densely populated urban areas voted. And then even then, right, if you dive into, well, why is it that people in rural areas and urban areas vote very differently? Maybe it's that they have very, very different conflicting ideas about what the policy should be. And at least, this is like a matter for debate, right? This is actually, there are some salient cases where, like, Second Amendment kind of guns, that's like one where there are actually very different issues. But if you look at a lot of the stuff that's around economics or around education, like, there's actually not a very broad difference in what people want. And so my instinct is that it's more about the way people approach these issues, the way people talk about these issues are extremely different. And of course, because we have structurally, people in rural areas are not proximate to people in urban areas, it's actually very difficult to kind of get the type of connections that you need in order to, see past the fact that, people from one area might talk about things, they might talk about their values in a way that's very, very different, but at the same time, they may all actually support those types of very popular policies, like a increase in the minimum wage or, more broadly available healthcare or affordable prescriptions or something like that.
Yeah, I mean, I think your point about when there were not big differences between rural and urban voters, and so the distinctions between big and small states in the Senate didn't matter. I agree, but that is not the case anymore. And so it in fact amplifies the voices of one set of views and undermines this idea of sort of one person, one vote, which the Senate was designed to do, but it's been exacerbated as those populations have changed and as the views have become really different. And then you layer on top of it another thing, which I left out, that's the Electoral College. And so now you have this design of the United States Senate, which is fundamentally undemocratic by design, but now is skewing to one viewpoint very heavily. You layer on top of it the filibuster, then you layer on top of it the Electoral College, which any way you slice it is not a democratic institution. It does not guarantee one person, one vote in the election of the President of the United States. And it was designed for a reason. It doesn't exist anymore to respond to the slave states. So the reality is you take those three things, and it's not hard to understand why people think, like, oh, actually, the government as it's currently designed is not working for my family. Because it's not. And so I just think, like, we can talk about restoring trust, but we've got to fix, I hope we will fix somehow the structure so that we can at least have a fair shot at government reflecting the will and desire and hopes of the vast majority of the people in this country.
Yeah, good. Francesca,
I'm
you've
going to
been-
interject with,
Yes.
a public health comment.
Yes. Sorry. This is a Watson
What are we talking
school.
about
So
here?
I was like, get out of the way. Let me get out
He's
of the way
my
of
dean,
that.
so I have to be much more deferential.
He's on my board, so I have to be deferential.
I
This is-
forgot that.
David, this is called balance of powers.
Well, but I love I actually told David right before we came in, I was like, David, you're normal. You're a normal person. He said, nobody's ever called me normal before. And, but I appreciate that so much and your passion behind it, because I think normal and passion is probably going to get us a long way in this problem. And I was, as you two were talking about electoral college and filibusters, the thing that I was thinking about most was like the people's participation and the tension between being participatory. You're talking about participatory budgets and the tension with paternalism. And in public health, we struggle because we're like, we have data, we know it's good for you, we know it's right, you should do this. And I'll give one little story of so I'm trained as an emergency physician, and I was working in the ER in the height of the pandemic. And when vaccines came out, I was so excited. I was like very close to being first in line, got my sleeve rolled up, went into work. And one of the nurses who I had worked with for a very, very long time, someone I trust like enormously in the trenches, was like, I'm not getting vaccinated. I can't believe they're mandating us to get vaccines. Like, and I was like, you don't believe in the vaccine? And he didn't have a fundamental issue with the vaccine. The issue was with the mandate. And just like highlighting this tension between like autonomy and making decisions and the paternalism of that, what that vaccine mandate was going to do. And now I've pivoted and working in the space of addiction medicine. We spend a lot of time talking about harm reduction and like giving people choice to make decisions, like equipped with data and trying to like reduce harms. And so I think like part of this, like, yes, we have the policies, the institutions, things like that, but at some point it has to come back to the individual level and letting people make choices about their health and putting the systems and the structures in place that will hopefully allow them to make the right informed decisions. But I think this is a little bit where we have gone awry in taking this like heavy-handed paternalistic approach to things.
Yeah. Can I ask, I'm interested, Francesca, how do you think about the way in which health expertise is communicated? Because it feels to, right, one issue is this kind of, libertarian versus communitarian perspective about, do we mandate X or Y or Z? But it seems like another dimension of this, like not a week goes by that I don't open up some newspaper and someone's making some like obviously spurious claim about the connection between some food or some behavior and health. So like to, pick an example, right? For a long time, the people would say, oh, like actually like having like 1 or 2 drinks a week is okay for you. And like that turned out to be based on the fact that in the data, it is true that people who have 0 drinks have higher mortality rates because when people are like super sick, they don't drink. And so, that's a silly example, but, to what extent do you feel like when expertise is being communicated, it's being communicated with like an appropriate level of like, how really sure are we about what is going on here? In order to separate, some of the things we're going to be like really, really sure, and there's like very bad consequences for not following that advice. And some of the stuff we're like maybe not so sure, and maybe like, look, like on balance, I wouldn't do this, but like whatever, like live your life. It seems, are we communicating that in a way where we're like
we actually do a terrible job
out?
at communication, and that the people who have the most expertise sometimes are reluctant to oversell findings, to be called an expert. And so what that does is it creates a vacuum for people who are very willing to be called experts when in fact they are not. We're spending a lot of time now thinking about training our students, the future leaders of public health, about how to effectively communicate. And that example, like silly, not silly example, but also like data changes, data evolves, and how do we communicate those changes and walk this line of overselling information and standing up when we do have the expertise and we do have the data. And I think a lot of lessons learned from there in the pandemic as well. And we've been doing the autopsy on misinformation and communication of data findings. But this is like, I think we don't do a good job of that. I think at our school, we're trying to do a better job. We have people like Stephanie Friedhoff and the Information Futures Lab. And so I don't have the right answer, because I think that there are examples of some people doing it well, but as a discipline like public health medicine, I don't think we do it effectively. And so it allows misinformation to creep in.
Well, thank you all. I have, I think, 10 more questions I could ask, but I know I've seen a lot of engagement and reaction in the audience, so we want to open it up to the audience to ask questions. And I think we have a microphone that'll go around, so we'll open it up and then we'll close out together.
Hi, I'm Tammy. I'm a first-year MPH student. I just wanted to ask the panel's opinion on operating in a post-truth world, in a world where essentially it feels like objective facts don't hold the authority that they did in the past, especially in regards to health communication. I have family members that are also like Ivy League educated, but they don't believe in things like vaccines anymore, or are consuming raw milk, which are things that are like objectively wrong. But I'm really pushing back against like just dismissing their beliefs and saying it's not because they're not educated. Obviously they are, but this like feeling that they have that that expert news or expert opinion no longer matters, and pushing the emotional aspect of things. And so I'm wondering how we, I guess, build bonds when things seem so different and what feels like truth is no longer what's held up high. But yeah.
Thank you.
So I would just say I do think what the dean just mentioned about communications and thinking about continuing to use trusted messengers is really critical. And so, when I hear something that would come from the School of Public Health at Brown University, I would accept it, period. But in the moment we're living in, I think thinking about who else could deliver those findings. And I'll just give you a personal example. I hope I don't get in trouble for revealing this, but I have a nephew who would not get a vaccine. And my sister, it's sort of this interesting household. My brother-in-law, very conservative Republican, and my nephew, the same as his dad. And then my sister, uber liberal Democrat, and her daughter is even more liberal than her. And so it's this sort of divided household. And so my sister's attitude was, I don't want to hear this craziness. And she's sort of like, I go over to my nephew's house. I spend 3 hours with him, starting off like with the Mueller report. It was like, and where did you get, why do you think it's not safe? And then I sent him a whole bunch of materials from the National Science Foundation, that, Institutes of Health. Now, eventually I was successful in making the argument to him, but I loved him. It took 3 hours. My sister's like, you don't live with him. And that was a microcosm of what we have to do in the world. You can't have a 3-hour conversation with a complete stranger about this stuff, but being open to why do you think that? Where are you getting that information? Would you be willing to read something but part of it is, I think, just like my sister was an example of just I'm not dealing with this craziness anymore. And it's just and she said, you don't live with them, you don't have to hear it every day, but it's the idea of how do you respectfully engage with someone who you can't believe what conclusion they've come to in the face of all this empirical evidence, but do it in a way that says, why do you think that? And again, I was willing to do it with my nephew because I love him. I want him to be safe. There's a lot of people in the country I don't have a relationship with that I wouldn't necessarily be willing to spend 3 hours with. But if we could all be trained to approach these conversations with that kind of, set aside your own certainty about something and be open to why do you think this? And will you read some materials I send you? And I'll read stuff you send me. And what's the source of that? It's an imperfect answer, but I do think it's going to require lots of that if we're going to rebuild a community in which people trust each other and trust facts, and it's a challenge. And I'll say the last thing is I think it's especially a challenge when we have elected officials, who we at least we expect elected officials, everyone embellishes a little and they're politicians and they're making their case, but we've not lived in a time where at scale people just misrepresented facts, kind of who had important positions of trust, and I don't know that we know what to do with that. I think it's a hard one.
Yeah, and what I was going to say is that, really there are two parts of this. I think I completely agree with David that on this subset of issues that have become kind of highly politicized along partisan lines, right? This is just a very polarized country, and the result of that is that there's kind of a lot that you have to work through that may have nothing to do with vaccines or health per se, but that you have to work through in order to kind of get to where you're trying to go. And I completely agree with David that trying to engage and trying to understand where someone's coming from, even if you don't end up agreeing with anything that they have to say. Just like trying to understand that perspective is important. And like my instinct is that more often than not, you actually are going to learn something that's like, oh, like, yeah, like I hadn't thought about it from that direction. Like you may not change your mind on like the underlying policy or whatever the thing is, but having that appreciation, having that humility for the fact that lots of people experience the world in different ways is so important. What I will say though is I also think that we should not overstate the extent to which the fact, that some of these issues have become kind of highly politicized, and the type of issues that have become politicized are broader than in the past. Like the vast majority of stuff has not become politicized, even in politics, right? There's you would be, amazed actually at some of what even an institution like Congress can get done when like no one's paying attention and they're just like two people trying to work together to solve some problem because it hasn't like hit that level where suddenly it's a polarized issue. And so I think that while it's very, very important to really think carefully about how we bridge those partisan divides on those issues where they've arisen, we don't want to just assume that everything's going to be like that, because then we actually risk creating more issues that are part of this partisan divide when it didn't necessarily have to be it before.
We'll open it up for another question.
We have another one over here.
Good afternoon. My name is Diane Newman, and I'd like to bring us back to the public health area because I think that that's why a lot of us are here today.
Sorry.
No, I just like,
That's
we
my fault.
we were getting into things like persuading your nephew. And I appreciate that that's important to an individual. But I'd like to go back to state policies. And I'm not focusing here on Rhode Island because I think we're actually doing a lot better than a lot of other places. But the trust in messengers, we all think about Dr. Fauci and what this did to his life because he stood up for what he believed in the face of tremendous pressure. I read this weekend an article about the veterinary medicine world in which states are saying maybe we don't have to require that all the dogs and cats get rabies vaccines. Now that becomes a public health nightmare at the state level if a state decides you don't need those because dogs and cats haven't read the boundary signs between states. They don't know if they're in Massachusetts or Rhode Island or Connecticut or wherever. How can we make progress on getting state legislation, because I think getting federal legislation at the moment is probably unattainable, to coincide? For example, in Florida, starting next year, they're not going to require vaccines for kids before they start school. Well, that's a pretty scary thing. And don't believe that kids in Rhode Island don't come in contact with kids in Florida. Everybody goes to visit grandma and grandpa in Florida over Christmas break or in the spring break. So let's go back to what can we do at the state level and maybe eventually at the national level to make public policy align with what we understand from a scientific perspective.
Thank you.
I mean, I think the Florida example is probably, it's in the news, it's serious, it's a concern, but I think by and large, there are bodies where the state legislatures are working together. So National Conference of State Legislatures, I actually spoke about opioid policy in this past year, and the amount of enthusiasm, agreement, shared understanding of the problem, people willing to kind of talk about, yes, their own issues, and the issues in Alaska are very different than the issues in Rhode Island, but kind of working together. As you're talking about like a coordinated effort across states, I think that does exist. And it's sort of like, as John was saying, like when no one's looking, people do work together, and then these contentious things rise to the surface. But I think there are avenues. There's an association of state and stat networks, state, territory, and I'm totally blanking. Who's somebody come up with the acronym for me? Yeah, AASHTO, where all of the health officers across the country get together and they populate ideas and they talk about what's happening in their states and try and share best practices. Those systems are there. We have to leverage them more. There's also opportunity for professional societies. And I think this is a bit of a role of academia for us to step in and be advocates. And I think, as you're saying, like, accomplishing things at the state level is a means to be effective at a time where I think we appreciate dysfunction at the federal level.
Yeah, I would just say one thing, though. I think your example illustrates the sort of other problem with that approach is, I mean, it had been the history in this country that states would do things and eventually there would be a body of sufficient evidence, whether it was about a vaccine or something, that the federal government would take action to be sure it applied everywhere in the country, even places that resisted that. That's no longer the case, but we don't want states working together, or at least I don't, who are going to follow the lead of Florida in that example. That's the other danger. When you have, states doing this, you encourage it if they're following evidence and fact-based analysis and good public health policy. That's great. If they're following the example you gave, that's not great. So I think it gets back to less about if it's going to be the state or federal government doing it, but that public policy is informed by actual data, good public health policy, and to the earliest question, that the truth matters in these examples. So I don't think it solves the problem if states do it if they're not using good empirical evidence to make these healthcare decisions. So then what? Yeah, I think continuing to press as hard as we can in whatever roles we're in, that actually empirical evidence and facts matter, the truth matters, and we owe it to people that decisions be made on the best, most accurate information. I mean, I don't think there's a substitute for like accepting we're going to live in a post-truth world. Like the consequences of that are horrific. So I mean, I don't have an easy answer, but I just think remaining very insistent that facts matter, evidence matters, public health policy should be driven by good evidence and not anything else.
I might also I think if we start going around saying things like we're in a post-truth world, I might push back on that a little bit, because then it's like a self-fulfilling prophecy. And I think that actually the vast majority of Americans, when you survey people, believe in vaccines, believe in these things. And so we shouldn't let people, the minority speaking from a megaphone, set this narrative that truth doesn't exist anymore. Although definitely the point is well taken, and I feel like in reality that we're experiencing that megaphone is very loud and in our faces a lot of the time. But the truth is it still exists and it's still important. And most people believe in science, right? Most people believe in science.
It is. Thank you. So I think we have time for about one more question, maybe two. Well, maybe over here to. There's a lot of hands. Yeah.
Hi, my name is Shweta. I'm a graduate student both at the School of Public Health as well as Watson.
We love that.
Yeah. So my question is that we're all talking about the need for evidence, but given the recent funding cuts at the federal level, and with a lot of this impacting collection of public health data sets that are vital to this information, is there anything we can do at a local level to mitigate this, or to prevent us from creating this lacunae that will maybe we don't see the impact right now, but in the future, how will that impact our decisions for the set evidence that we're using as a basis?
Thank you.
I mean, we are living in a moment where our partnership with the federal government to address questions that are important to human health is fractured. And that means that people have to step in and help. This is private institutions like Brown. This is private foundations like the Rhode Island Foundation, corporate and industry partners. We can't stop doing the work, but we have to think about the ways that we preserve the work, that we sustain it financially. And this is a pressing challenge. I mean, it has been a luxury, I think, to have that partnership for a long time. And it has changed. It has fundamentally changed. But having data, access to high quality, open access data is really important. and this is where others are going to have to step in, and so we're going to have to be part of those others.
I mean, what I was going to add to this, to kind of pull it back to the kind of civic health part of the conversation where we started, is that, as I think we've all talked about in various ways, that's actually fundamentally a local issue, right? It's local in the sense that it's really about what's going on like right around you. That's really what's mattering. And it's also local in the sense that who the trusted messenger is or what the institutions look like that you're going to want to use this for may just be very, very different, whether they're in Rhode Island or in Alaska or in Oklahoma or in New York or wherever. And so, there's a funding challenge, which kind of I don't want to minimize, but I think fundamentally a lot of, whether this is about civic health for the perspective of promoting public health or economic health or whatever it is, a lot of the action, I think, really, from a policy perspective, can happen locally. And that means that, fine, you may get a little bit more divergence between what's happening in different states, but in most cases, that's actually totally fine. And I think having that greater prominence of local and state level institutions in this stuff is maybe actually not a bad thing when fundamentally the problem to be solved is going to vary so much from place to place.
The only thing I would add is I do think that to the extent that we want, that civic health is impacted by people's access to trustworthy, reliable information, and public health is obviously driven by the generation of good data and good research. I don't think we can minimize the impact of a significant reduction by the federal government in research. I mean, that's a fact. And while I think, universities and states and philanthropy can do something, the scale at which the federal government invests in research can't be, it can't be backfilled by any of, whether it's state government, philanthropy, or universities. That is not to say the balance is correct. Maybe, I don't have a view, maybe the federal government is spending too much on research. I don't know, maybe the private sector should be doing more or whatever, but the massive reduction of federal investments in research, I think, are inconsistent with a framework that says we want really good data, really current data, the best research to guide it. You just can't have both things. So I do think we as a country have to be sure that we are insisting that the federal government, devote appropriate resources to medical research and science, or we're going to all suffer as a consequence.
Well, I believe we are just about out of time. I want to thank our distinguished panelists for sharing your insights today. You've given us a lot to think about as far as some of these barriers that we face, but also some avenues for hope and connection and how can we collectively work together. So though it is a daunting picture, I really appreciate the way you've shared and framed, and I know this will spark lots of conversations, I think, in the folks in the room. So thank you very much. We appreciate it.
Thank you.
Thank you.